The Leader of the Third Party.
Mr. Speaker, last November I rose in the House to acknowledge and honour the brave fight that well over 160 Alberta families will wage annually when they hear the word their child has cancer. Today, I introduced you to Lindsay Moravki, whose 3-year-old daughter Greta is fighting for her life. And while she has been afforded the very best care we have in Alberta by oncologists at the Alberta Children's Hospital, her parents now have to take that fight to Cincinnati to get the life-saving treatment and liver transplant that she needs to survive. To the Minister of Health, why has this government not done more to date to help pay for wee Greta to get this liver transplant?
Good question. The Honourable Minister of Health.
Our hearts and thoughts go out to Greta and her family during this incredibly difficult time. I want to thank my colleague, the member for Calgary Northwest, for meeting with the family and bringing their heartbreaking situation to my attention. My office has also reached out to the family, as has the department, to ensure that they are aware of options that are available to them. But of course, this is a very tragic situation, a very difficult one, and we continue to provide options, including information about other medical opinions that might be available to the family, and we'll work with them to ensure they know what options are available to them. But this is, of course, very difficult, Mr. Speaker.
First supplemental.
Thank you, Mr. Speaker. Greta needs of an operation, unfortunately, not pamphlets. Greta's doctor in Cincinnati believes she has a good chance of survival with this transplant, which is not available in Canada. On Friday, she was placed on the transplant waiting list, but it will cost this family $1 million in order to get the surgery done using a live donor, and thereby pushing the surgical procedure and her treatment ahead of the slow pace of progress for children with hepatoblastoma. To the Minister of Health, do you think it's okay for her parents and grandparents to risk bankruptcy and rely on sympathetic Albertans to fundraise for Greta's transplant?
The Honourable Member. Deputy Premier.
Thanks again, Mr. Speaker. And of course, as I've said previously and in other situations, it's incredibly important for health professionals to be making these decisions, and that's why there is a committee of physicians, the Out-of-Country Health Services Committee, which is comprised of physicians that review these specific circumstances. We've talked with the family about options that might continue to be available. I have to say, I understand the desire to do everything possible to try to create an opportunity to save a child's life. I would probably do the exact same thing the parents are doing, Mr. Speaker, but we need to make sure that physicians are the ones driving these decisions, and we have the physicians in place that do that, Mr. Speaker. Again, we'll work with the family to consider other options.
Thank you, Honourable Premier. Second supplemental.
Mr. Speaker, it takes the will for the government to do the right thing. There's rules. They don't have to be written in stone. The health minister could give permission to fund the surgery and thereby give Greta a chance at life. Without the surgery, there is little hope.
That's right.
Except for a miracle, and Mr. Speaker, there's no time for miracles. We need the government to act. Let's get our priorities straight. To the minister, you have the authority. Will you promise to meet with Greta's mom today, and will you make everybody's day by promising to fund this life-saving surgery?
Please, Minister.
The Deputy Premier.
Thank you, Mr. Speaker. As a politician, I respect that doctors must make treatment decisions that sometimes are very difficult based on effectiveness of specific patients, based on a case-by-case basis. So, Mr. Speaker, the Out-of-Country Health Services Committee is an arm's-length committee comprised, again, of physician experts. My office has been in contact, as has my MLA colleague, and of course I'd be willing to meet with the family. We will continue to provide support to them, and again, thank you to my colleague from Calgary Northwest for her work to make sure that this family is supported.